Hi, this is your Houston Chiropractor, Dr. Gregory Johnson, and we've got Robert here with us this morning. And Robert came in here as a result of watching our YouTube videos, and he's seen me adjust patients who have already had back surgeries, and then they still get the same problems that they had before they had the back surgeries, and that's exactly what happened with you, isn't it?
Yes, sir, correct.
You had a laminectomy done in 2015 December.
2016.
At L5. And S1, you were having right leg pain back then.
Yes, sir.
And what is your main complaint today?
Right leg pain again.
And low back pain.
Low back pain.
And right SI joint pain going all the way down his right leg.
Right, getting down. Yes, sir.
We call that failed back syndrome, sir. That's exactly what that is, failed back syndrome, which means that the surgery, while it may have had some temporary relief to him, has now failed, and the symptoms exactly the same, and probably even a little worse, have come back and plagued him now for how long?
Couple of years now.
Couple years now. How long you been watching this on YouTube?
Just within the past week.
Oh, okay.
Yes, sir.
You're a smart one getting in quickly.
Yes, sir.
Okay, I'm going to have you close your eyes and bend your head forward and backwards for me. And then neutral. Now this is really important posture that you can see on him. You can see how his whole pelvis and lower lumbar spine have translated to the left of center. He's got little space here compared to a lot of space over here. And it tilts way off to the right here. That's called antalgic posture. And his head's forward into the left of center. So he's got a big old curve going all the way down his spine. He's got scar tissue back here on his lumbar spine where he had the surgery done. You can see a big old scar right there, about 2 inches. Do you mind if I show him that?
No, go ahead.
There's the scar from the L5-S1 laminectomy surgery. Now this is all fibrotic adhesions and scar tissue around there. That's probably pretty sore all over there, isn't it?
Yes, sir.
Yep. So we've already done his orthopedic neurological evaluation, which is quite lengthy, so we didn't show that, so you'd watch the whole video. So I'm going to adjust him for the very first time today. I think I can help him with this. We're going to have you lay on your tummy for me here, Robert, with your face all the way up in here, please, sir. Now, with him already having this laminectomy surgery, I'm going to adjust him specifically the best way that will help that. His right leg is short by over ½ an inch in the prone position here. Now when I bring his legs up, you can see it actually gets longer, and that really tightens up in your low back, doesn't it?
Yes, sir.
Yep. Now he had a positive straight leg raise test on the right at about 40 degrees with pain shooting down his leg too. He also had a right sacral deviation test. I'm just going to show you that one again. Go ahead and lift your whole right leg up. Okay, that hurts, doesn't it?
Yes, sir.
Now do the left one. Look how much higher he comes on the left side. That didn't hurt near as much, did it?
No, sir.
He's got a right sacral deviation. He also has a right sacroiliac subluxation because his right leg's shorter down here, but when I bring it up, it gets longer and his low back elevates and hurts. That's called a positive Knockless test. Palpatory examination reveals that his SI joint is out right there on the right. That's probably pretty tender. His right sacrum's out right there. And there's L5.
Yeah.
There's L4. These are all sore, aren't they?
Oh, yes, sir.
Now see, you're supposed to have a smooth forward lordosis in the lumbar spine, but his has flattened out due to muscle spasms. That's why he has antalgic posture. And then palpating here, he's got mid-thoracic subluxations here at T6, T7. Those are tender to touch, aren't they?
Yes, sir.
And those are tender right there as well.
Correct.
It's that lower thoracic area we were talking about that usually compensates for the low back. Tight shoulders on both sides, muscle bundles in his trapezius muscles. He's got C6 and C7 misaligned on the right. He's got C3 and 4 also on the right. But he has a atlas and occiput subluxation on the left where he gets headaches up here sometimes.
Correct.
Alright, so we're going to give him his first adjustment, which I'm going to adjust his right sacroiliac joint first. because he has a right sacrodeviation too, I'm going to adjust his sacrum on the right side, straight P to A and S to I, driving it away from the L5 vertebrae. There's the middle of his sacrum. Will that move good? That's the left side of his sacrum. Now I'm adjusting his left SI joint more internal to external. You notice this one I'm driving it straight 45-degree angle down this way. There we go. Now I'm going to move up into his lumbar spine at L5 first. Probably going to be a little sore touching it. Yep. There. There's L3, that was real tender. L2, these guys are also, aren't they? I'm hitting L5 again. Now I'm moving up into his lower thoracics. Okay, just keep breathing normal. I'll catch you. There you go. Alright. There it is. I knew it was there. Yeah, I got you. Had to catch you between bucks. See where I get my workout? Look at there.
Oh yeah.
It's exactly even now. Tell me if this hurts as bad as the first one did.
No, sure.
Great. That's a good start. That's C3-4. There's C5-6. Now I'm actually going to move all the way down on T1, T2 to help bring his whole head and neck back up over his posture biomechanically. Just turn you on your back now, please, sir. Probably already feels a little bit better down there.
It does, yes, sir.
Now I'm bringing his whole head up and back on the x-axis. There we go. Good. Now we're going to slide down this way a little bit. And that's good. Put your arms straight out to the sides. You're going to feel your upper back popping up. I'm going to adjust both shoulders. Your clavicle over here on the right. Your clavicle on the left. Your anterior ribs right here. Good. Okay. Now just relax your hands on your tummy. You're probably going to love this one and hate it all at the same time. Okay. There we go. Now you should have felt that in your knee all the way up to your low back.
Yes, sir.
Okay, just let this one go in my hands here. There we go. Yes, sir. That hip pain you've been feeling? That's separated right there. Did you feel it?
Yes, sir.
Okay, let's hit you up, face this way. No, turn this way sideways. Turn sideways, don't ever sit straight up. If you sit straight up, the vertebrae have a tendency to go backwards. That's where the nerves are and it'll hurt. So you always want to sit up sideways. Okay, relax your shoulder. Keep breathing. Don't hold your breath. Keep your chin up. There. Okay. Try to let me do everything. Just relax it completely. There we go. Better. Get your elbows here. Good. Good. Yep. There, good. Okay, let's come over here and lay on your back next. On this table, your pelvis is going to lay right here and you
Okay.
head up this way.
All right.
Now he's got a lot of fibrotic adhesions and scar tissue that's developed down there in and around that L5 sacral area, L4 area, and even though he's had the laminectomy surgery down there, this will not hurt that. It's only going to open up the disc and open up the joints, take the pressure off the disc and the joints, but it's probably going to rip some scar tissue loose down in that L4, L5, L5S1 area. Just let your legs bend and relax. Good. mean, y'all keep asking me to do videos showing you how to sleep. This is how you should sleep, right here. On your back with your legs elevated. You have to put it like a closed basket or a couple of huge pillows down there. Deep breath through your nose. There you go. Now you should have felt that all the way down.
Oh yeah.
Wow, you're a trooper. You did good. Look at there. Reflexes are even better than they were the first time. Okay. Now, once you let your head relax in my hand now. Good. Drop it in my hand. That's it. Good job. Crack eggs are gonna love you.
And yes, Dr. Johnson and I do sleep like that.
Yes, we do. We'll do a
And we do
video of Joseph showing you the proper sleep postures and exercises and stuff here soon. Let's come over here in front of the table. Now get up sideways, remember. Bring your legs over and then push yourself up sideways.
Perfect.
There you go, just like that.
Yeah.
That's easier, wasn't it?
Oh, yes, sir.
Here you go.
All right.
Alright, so I'm going to have you close your eyes again and bend your head forward and backwards again. Then back to neutral. Take a look in the mirror right now. Okay, so your pelvis still shifted quite a bit over to the left,
Right.
so we're going to pull these shoulders up and back. I need you to hold those there for me. Flare these hands, palms forward, backwards like this. Now this is going to be the hard part for you. Just let your neck go. Let me do it. Spread your feet a little bit further apart. Okay, now I need you to shift your pelvis straight right towards your wife. No, further, hard as you can. Okay, now look backwards at the wall back here. You're going to feel a little tap right there. Keep that pelvis shifted way right. I'm not stapling them together. I'm just bouncing the muscle spindles down here so that it will change in the Golgi tendon apparatus. Okay, now relax. Okay, now let's have you close your eyes again and bend your head forward and backwards again. Tell me if this feels any different to you that time.
I do, yeah.
What's it feel like differently?
So I feel a little bit lighter. It will feel like I can move a little bit more freely than I did when I came in.
Did it feel smoother moving your head forward and
It did.
backwards?
Yes, sir.
Okay, now see how we opened that up a little bit? Down here, it's not completely symmetrical yet, but
Right.
you've got more room here than you had before.
Correct.
So our job is to get your pelvis over in the center and line your spine up straight and take the compressive stresses off of the joints and the disc and the nerves down here in your lower lumbar spine and your sacrum. Line your sacrum and pelvis up.
Yes, sir.
So this being your first examination and treatment here, you've been to other chiropractors
I have, yes, sir.
and you've been to medical doctors for this.
That's correct. Surgeons, medical doctors, chiropractor.
Had injections.
Had injection, did 3 sets of injections, had the laminectomy surgery.
And that was really your protocol. Do the injections. Those don't work, get surgery.
Kind of just follow the line, yes, sir.
Yep. And how did this work for you for the very first time compared to all that?
Compared to the other chiropractors, I hadn't experienced anything like what you just did. I actually feel a lot better just coming in and doing the adjustment at this time.
Okay,
Yeah.
great. Well, thank you for sharing
Thank
your
you, Doctor.
experience with
Appreciate it.
everyone. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.